a name and date of birth?
Kaylee Baumgarten, December 2nd, 1984.
Okay, perfect. Privacy, and I'm going to check your wrist bracelet. Alright, do some hand hygiene. Put my gloves on. And what is your height and weight?
5'6" and 140.
Okay, great. I'm going to ask you 2 questions. Do you know today's date?
Yes, April 27th, 2017.
And who are the last 2 presidents of the United States?
Donald Trump and Barack Obama.
Okay, perfect. All right, and we already did your vital signs, your blood pressure, temperature, heart rate, respiration, and are you experiencing any pain?
No.
Okay. All right, so I'm going to start with a skin assessment. So
Okay.
I'm just going to check your upper extremities. Okay. Skin is intact, dry, and expected for patient findings. Those look good. No lesions, no discoloration. Okay. Skin is intact. No discoloration, no lesions. And skin is warm to touch. Expected for patient findings. Okay. Down here on lower extremities, no pretibial edema. Skin is intact. No lesions, no discoloration. Warm, dry, and expected for patient findings. Heels are intact. Okay. And there's no edema on your upper extremities. Alright. And I'm going to go ahead and check your back as well. Okay, coccyx, the skin is intact, no lesions, no discoloration. Skin is warm, dry, expected for patient findings. Alright, perfect. I'm going to go ahead and check your skin turgor. Alright, good skin turgor. Good skin turgor. Okay, perfect. Okay, so I'm going to follow up with a head assessment. Just going to check your scalp. Even hair distribution on the head, lashes and eyebrows, no masses felt, no infestations. Okay, conjunctiva is moist and pink, sclera is white. Pupils are round, equal, and reactive to light. And look at my pen. Accommodation. Your nose is midline. Can you close one nostril for me and breathe in? And the other one. Good patency. Alright, here's your midline. No drainage. I'm going to go ahead and palpate them. Let me know if you feel any tenderness.
Nope.
Okay. Lips are pink and expected for patient findings. Can you open your mouth for me? Okay. Can you stick out your tongue? Great, no deviation. Gums are nice and pink, expected for patient findings, and wrap around the teeth, which are intact. Alright, I'm going to go ahead and take your carotid pulse. Okay. That was a 2+, and it's equal bilaterally. Trachea is midline. Okay, so I'm going to follow up with a pulmonary assessment, so I'm going to listen to each lung sound for a full breath cycle. Actually, I'm going to have you sit up real quick. Okay. all lung sounds are clear, no adventitious sounds, anterior and posterior chest and lateral as well. Okay, go ahead and lay down. Go ahead and do your cardiac assessment. I'm just going to check your fingers real quick. Okay. Good capillary refill. Your toes. Okay. Capillary refills within 3 seconds. That's good. Okay. So now I'm listening to your aortic heart sound. That's the right intercostal. And the pulmonic, which is left intercostal, and that is where I can hear S2 the loudest. Herb is a third intercostal, and mitral, which is fifth. Left intercostal, which is left of the sternum, and mitral, which is fifth. Left intercostal, mid-clavicular, and that is where I can hear heart sounds the loudest, and as well as S2, that's where I can hear S2 the loudest, and that's where I'm going to listen to your apex of your heart for a full minute. Okay, that was a full minute. Heart rate was at 62. No pulse deficit. Okay, we'll listen to your brachial pulse. Okay, equal bilaterally, and that's at a 2+. Your radial pulse. Equal bilaterally, and that's also at a 2+. Okay, popliteal. Equal bilaterally, and also a 2+. The dorsalis pedis. So a 2+, equal bilaterally, and posterior tibialis. Okay, equal bilaterally, and that's at a 2+. And there's no pretibial edema. Okay, I'm going to go ahead and do a abdomen assessment. First, I'm going to check the contour. Okay, good contour, no mass is visible, no pulsations, good symmetry on both sides. The umbilicus is inward, no discoloration. I'm going to listen to each field for 2 minutes, each quadrant. Okay, normal vowel sounds. I'm going to go ahead and palpate lightly. Let me know if you feel any tenderness. Any tenderness? I'm going to palpate a little bit harder. No mass is present. No protrusions. Any tenderness? Okay, great. I'm going to go ahead and have you flex your arms and extend, and then go ahead and do the same with your wrists. Okay, and squeeze my hands. Okay, I'm going to have you shrug your shoulders, and can you move your head from side to side? And can you resist my hand? Okay, go ahead and flex your knee. Okay, extend, and the other one. Okay, symmetrical. Go ahead and do that with your feet. Flex, extend. Okay. Can you push down on my hands? And the other way.